ReachMD XM157 now presents a special programming series, Focus on Cancer.
The customer is often first when seated at a restaurant table or when he or she walks into the lobby of the Ritz Carlton, but it can be a new phenomenon in healthcare. But a chain of cancer centers is finding hospitals, too, can provide customer-friendly care with specialized food, massage therapies, and alternative treatments to complement the traditional chemotherapy and cancer treatment regimens. Welcome to the Clinicians Roundtable on ReachMD XM157, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter with the Chicago Tribune, and with me today is Dr. Edgar Staren, the Senior Vice President for Clinical Affairs and Chief Medical Officer at Cancer Treatment Centers of America. Cancer Treatment Centers of America operates hospitals in Philadelphia, Oklahoma, and Northern Illinois, with a fourth opening by the end of the year in the Phoenix area, and working to expand services in Georgia as well as Seattle, where it has an outpatient center. Dr. Staren is a practicing surgical oncologist. He graduated from Loyola University Stritch School of Medicine in Chicago. He completed his general surgery training at Rush University Medical Center, and in 1988 completed a surgical oncology fellowship at Rush and Cook County Hospitals. He is involved in many national cancer and academic associations, and he joins us today from Cancer Treatment Center's headquarters in Zion, Illinois. Dr. Staren, welcome to ReachMD.
Thank you, Bruce. It's a pleasure to be on.
Well, I have had the privilege of seeing your operation up close, and I know that it's a model that has been around for quite a while, which you might find a little funny because a lot of your rivals in the healthcare industry are sort of just getting with the program on customer-friendly care. So if you could, for our listeners out there who are not familiar with Cancer Treatment Centers of America, walk us through some of the things that they do and also where they're headed. And potentially there are probably some organizations that are thinking to themselves, boy, we should have been doing that.
Sure. Well, our organization was founded in 1988 by Mr. Richard Stevenson. Mr. Stevenson's mother, unfortunately, developed bladder cancer, and her disease progressed. She was seen at a number of well-known medical centers around the country, and it was his and the family's feeling that she was treated more like a number. It was certainly not a patient-centered type of an approach. So with that, he made a vow that he was going to change the face of cancer treatment in this country and created Cancer Treatment Centers of America. The whole mindset is that of patient-centered or patient-focused. Most organizations, healthcare organizations, center either on the doctor or the hospital or the insurance or what have you. We do everything we can to focus on the patient, specifically identifying what the patient values. And they will vary. They vary according to their diagnosis, their previous history, their beliefs, what's important to them. We do everything we can through varieties of mechanisms, from interviews by phone and in person, surveys, constantly meeting with the patient and their family to determine what's important to them and provide that as an important component of their therapy.
Well, and tell me, has this positioned Cancer Treatment Centers of America at this particular time in the healthcare system history to be better prepared for what's coming down the pike as far as quality measure? And, and we're even seeing, that Zagat, the people that rate restaurants and so forth, are suddenly getting into healthcare through some of the payers. It seems that you guys might be prepared for that.
I think we are. Clearly, quality is an expectation, and an appropriate expectation on the part of patients and their families. You can't do that unless you measure. You have to have outcome measures, and they can be in a variety of forms. In a cancer center, it may be in the standpoint of recurrence, survival, but there's a number of measures that include quality of life, simply how a patient is feeling from the standpoint of their psychosocial state, fatigue, pain, a whole host of other important factors. Patients need to feel that they are empowered to make decisions. And the only way that can happen is if you give them information in terms that they can understand so that they understand the options and then can be empowered to be involved in the decision process.
And some of this, I know from being familiar with your organization, is as simple as returning a phone call. And I remember spending some time with yourself and Mr. Stevenson at your organization. And there are patients who will maybe see an ad. I mean, we know that Cancer Treatment Centers of America advertises on TV, and that's something that some people probably never would have done, and now you see hospitals advertising all the time. And you guys actually, and correct me if I'm wrong, when a patient calls your center, it's not uncommon for a physician to return the call to that patient.
Not uncommon at all. We have what we call oncology information specialists that are trained specifically to deal with patient issues 24 hours around the clock, 7 days a week, 365 days of the year. So when you call, you don't talk with a machine or have some type of forwarding to another area. You speak with someone who's experienced. If they are not able to answer the questions directly, then it's very routine for a physician or a specialist in one area to contact that patient and give them further information. We feel a great responsibility to make sure that patients are appropriately informed.
Well, if you're just joining us or if you're just tuning in or even if you're new to our channel, you're listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I'm Bruce Japsen of the Chicago Tribune, and with me today is Dr. Edgar Staren, who is an executive and chief medical officer at Cancer Treatment Centers of America, which has a chain, if you will, of hospitals across the country, and they're opening up more. And we're talking about customer-friendly patient care. And one of the things that Cancer Treatment Centers of America is known for, a lot of providers or consumers may know, is that they do a lot of advertising, they do a lot of outreach, but they also have been at the forefront of meeting some of the patient needs, just some basic things. I mean, some doctors are going wild because Zagat is rating them on whether they have magazines in their doctor's offices, and they think that that's sort of silly, but in reality, you guys don't think that stuff is silly because you guys have catered food and organic food and things that patients kind of want. I mean, can you tell us a little bit about that?
Well, I think it's, you've heard the saying, don't sweat the small stuff. We do sweat the small stuff. We sweat all aspects of what's important to a patient. What we've learned is that you can only identify that by communicating with the patient. They need to be talked to. It's routine to see the chief executive officers of our hospital doing rounds throughout the hospital. In fact, it's much more common to see them talking to a patient than it is to see them in their office. We believe that there's processes that can be brought into the healthcare arena that can improve efficiency and make the hospital stay, the hospital healthcare experience, more enjoyable to the patient. And that aspect of being involved and feeling more comfortable with that care experience certainly impacts on their overall therapy. Examples of some of the things that we do, we believe in lean thinking and some of the Six Sigma type activities that you hear in business principles. We'll look at waiting time when a patient comes in for their first interview. We found that when patients would come for their initial interview that it was taking 40 minutes. Well, when a patient comes to our facility, they're ill. They have a diagnosis most often of an advanced stage cancer. The last thing they want to do is be interviewing and filling out papers when they rather would be in a room being treated and properly dealt with. We've decreased that interview process to no more than 10 minutes. We do as much as we can prior to the patient arriving at our facility to get background information and communicate that across our organization so that they don't get repeated questions at the same time. We communicate among ourselves to try to facilitate the experience of the patient.
Well, and the interesting thing is you've worked in traditional, large teaching hospitals, practiced at Rush. You were a senior attending surgeon at Medical College Hospital in Toledo, Ohio, so you are certainly familiar with the large academic medical centers. What is the difference when you're talking customer-friendly care? Not specifically, those are fine institutions, but what would you see are the challenges out there for folks who may be listening in their own organization where at Cancer Treatment you may be doing things a little differently that you perhaps may have wished you would have done, or you go to places and see where they might be doing things that perhaps they could be doing a little differently?
I think it's almost as straightforward as two words. We refer to it as the mother standard. You look and see how an individual is treated, and you would want that patient to be treated like you would want your mother to be treated. And if they're not, then you look at the situation and identify the various steps from A to Z that are preventing that type of an experience. It may be wait time. It may be an inappropriate relationship. In other words, a person may not have the same level of friendliness, the simple holding of a hand, rather than telling someone where the elevator is, taking them by the arm and walking them to that area, putting your arm around them and making them feel like their family. The natural result of that is just giving them high quality, safe, excellent health care.
Well, and the interesting thing at Cancer Treatment Centers of America, you folks have done a lot of marketing and sort of internal measuring that perhaps some people would have rolled their eyes at maybe like 10 years ago. But in reality, now everybody's doing that. Now, how do you feel about that?
Well, I believe that that's a good thing. Clearly, that's the type of care that patients should receive. We believe that not every patient is going to be coming to Cancer Treatment Centers of America. And hopefully the example that we set will allow patients throughout this country and even abroad to be influenced with that type of mother standard of care, that high-quality, comprehensive care that we provide, so that they can all experience an optimal therapy for their disease. One way of looking at it is that there's so many aspects to healthcare beyond what we think of state-of-the-art traditional care. In the case of cancer, it's radiation oncology, medical oncology, and surgical oncology. While great technologic advances have been made in those areas, we fully expect that we need to provide that level of state-of-the-art care. But you can't forget about the complementary support areas of nutrition, psychosocial support, spiritual support, supplements, exercise, and a whole host of other factors that allow a patient to get the quality care about which you spoke.
Well, if you have just been joining us, on our program today has been Dr. Edgar Staren. He is an executive at Cancer Treatment Centers of America, which has been at the forefront of providing customer-friendly care at its facilities across the country. We have been discussing customer-friendly care. I'm Bruce Japsen of the Chicago Tribune. You have been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. We welcome your comments and questions through our website at reachmd.com, which now features our entire medical show library, including this show, in on-demand podcasts. And I would like to thank you today for listening.
Listen all month as ReachMD XM 157, the channel for medical professionals, as we feature a special series, Focus on Cancer.